Thank you, Harry. Thank you, Chuanyi. We are going to try to do some questions, and hopefully Harry can stay with us. Raphael, jump right up.
Okay, so Harry and Chuanyi, thank you very much for a very elegant mixed methods study that is really allowing us to go under the surface and understand better the determinants of the choices WIC participants are making with regards to redemption of CVVs for fruits and vegetables. So the specific question I have is, did you discuss, investigate, or did it come up spontaneously anything related to the amount they are receiving on CVVs?
Harry, can you hear the question?
Yeah. So I just want a clarification of the question. So what do you mean spontaneously see the prescribed benefits, CVV benefits? Can you clarify a little bit?
Yes, because you used like in-depth interviews and focus groups. I could see in an in-depth interview, asking specifically about what do you think about the amount of money you are getting on CVVs versus also this topic emerging spontaneously in a focus group when you're asking them, why,
Oh, got it. Okay, so it's kind of interesting response. The first thing is, we asked them exactly how much benefits prescribed to you every month, and I would say majority, 80% or 90% of the participants, they can tell you very clearly how much they got prescribed. Okay, but we didn't verify them, so they may give us a wrong number, but we didn't verify. But the other one is about in general, I think the response is they want more like a CVV benefits, more dollars on their EBD card. So it's very interesting because we target to recruit these redemption household with household into our focus group. But when we ask them, we don't tell them how you're going to get selected into the focus group. We ask them, how do you think about the benefits, EV benefits? And many participants say, oh, we want more dollars. So this is an interesting kind of, we will say, like they may think they redeem the benefits every month, but actually they are not. So from the behavioral economics, it seems like there's a gap between what they realize in their mind and what they behave in the reality. Okay, so this is a two response for your question.
Thank you very much.
I have one thing to add on. First, we asked the question in our interviews. For example, how many and what kind of benefits they redeem each month, or how much fruit vegetables they buy each month. We ask all those questions. So we can further to verify if the data is consistent with our quantitative data from the redemption data set. So right now we haven't done that yet, but later probably want to compare our qualitative research, so what's among the self-report, is that different from the objective data? So that will be interesting. Yeah, thank you.
Thank you very much. Very important data.
Thank you.
So I'm wondering what happens when the person goes to the store, has a desire to purchase fruits and vegetables, and finds out they can't use their WIC benefit. Do they switch to SNAP dollars? Do they buy it with cash? Or do they just go away angry or disappointed?
Okay, Harry, I can, while you think about that, I can answer a little bit about this question. So basically, during the interviews, we found some very interesting kind of coping strategy of those participants. For example, some of them, they trying to avoid the embarrassment. For example, each time they only redeem one product. Then they go to store multiple times. They make sure that if this product gets rejected, so they can pass through the line very quickly, do not block the line. This is one strategy used. Another strategy we learned from the interview is that some of them, they will try the different product at a different time. And also, another strategy used is that if they found one item, for example, the tomato can be redeemed, they will, every time they buy the same product, so they will not switch. So that's something we came out from the in-depth interview of the focus group. So they do have some coping strategies. They also, their feeling is kind of a little bit embarrassment. They're trying to coping with the situation. Okay, do you have more to add on, Harry?
Yeah, I think yeah, they sometimes for example, they know how to find any stores who are friendly. Okay, always have no problem to redeem WIC benefits. Then they stick with that kind of store. So yeah, as Chuanyi mentioned, we have only, I think I remember, one extreme case, which means somehow his family cannot redeem the benefits, so he just give up all the fruit and vegetable, because to this family, maybe formula is a primary reason for them to join the WIC program, and a few dollars on the EBT card, they just say, okay, I don't worry about that.
Thank you very much for this good information and detail about the use of the vouchers. I was interested in the ranking of the fruits and vegetables, and a bit, I was trying to understand Virginia relative to the other states. Virginia allows both fresh and processed. I noticed that corn was one of the most redeemed of the vegetables, and I wondered if you remember or could comment on whether that was in fresh or canned form or frozen. Was it processed?
Yeah, we can look at the data further, but at this level, we only know the product, the corn as a category. We can break down into the fresh or canned or like a dried or whatever, or processed. But based on the information we have, we haven't done that. But we can look at the data.
I have one further question. Hi, Harry. This is Shannon. I would be curious, your data on partial redemption was really fascinating. And your last comment also suggested that what you were hearing in your focus groups and interviews is that participants would like more fresh fruits and vegetables. So I wondered in your analysis if you could tell us, and I'm not asking for it right this minute, but how much zero redemption is there of the CVV, if any?
I think if my memory is correct, actually we did it. It's not much. It's like a 5%, 5 or 6%. And the good news is, well, I haven't done a complete analysis, okay, but the good news is for this group, they don't only kind of opt out the CVV. They may opt out the whole WIC benefits. So they are like enrolled, but they don't redeem any WIC benefits. So it's very comparatively, it's very rare for the participant don't redeem anything.
Thank you. I have to say with this team, I'm particularly impressed by how much a research group has really learned WIC. And I think it's a really nice demonstration of those partnerships between WIC programs in states and really high quality researchers who are there to really understand the program and make those relationships so that this research works. So thank you both, and thank you to your team and collaborators.
Thank you.
We get a break, and I have no idea what time it is and what time we're supposed to be back, and I'm looking for Marie. There she is. So what time would you like us back? We reconvene at 11. We'll see you then.